Well, cancer researchers around the country are testing new drugs that might someday slow down or stop the nation's second leading cause of death. One promising new drug is about to undergo human testing this fall after dramatic success in animals. Fox 5's Patrick McGrath has a special report.
Meet Mr. C, the Mostly Marmalade Cat of Bill French.
I love this little guy. It's very nice to come home and always have someone there to greet you.
French thinks he is very lucky to have Mr. C to come home to. A year ago, his weight dropped dramatically from 13 pounds to 7 pounds, and veterinarians said he had cancer in his intestines.
And they said they thought that he had at most a month or two to live.
But French had the good fortune to know Dr. Floyd Taub, who was testing a new cancer-fighting drug called betathine on lab animals. He was able to get a rare waiver from the Food and Drug Administration so that betathine could be given to Mr. C. A year later, the tumor has shrunk and Mr. C is thriving.
It's been wonderful to see him come back. I was very upset. I thought we were going to lose Mr. C for sure.
Mr. C's extraordinary recovery is no rare isolated case. Scientists have achieved impressive cures with years of experiments with betathine on laboratory mice. In testing at independent labs in Illinois, New Mexico, and Germany, researchers administered betathine to lab mice with various kinds of cancerous tumors. In mice with myeloma, the most common form of bone marrow cancer, 100% were cured. For the mice with melanoma, the deadly skin cancer, the cure rate was 70%. In mice with early-stage breast cancer tumors, betathine proved as effective as chemotherapy without the toxic side effects. And the lab mice were able to survive a much higher dose of chemotherapy when given along with betathine. Dr. Taub, who heads the private company developing betathine, says if it works this well in the upcoming human trials, it will be an extraordinary advance.
It would be a revolution in the way we treated cancer. One might say as big a revolution as the difference between treating an infection in the leg by cutting off the leg and antibiotics.
Betathine does not attack cancerous tumors directly. It stimulates the immune system, and it is this stronger immune system that is able to shrink and destroy the cancer cells.
We now treat cancer with very gross surgical means and very toxic chemotherapies. The classic slash, burn, radiation therapy, and poison chemotherapy. If this works in people as it does in animals, it will be potentially the equivalent of antibiotic or insulin, a first non-toxic way of approaching the disease.
But will betathine work on people the way it apparently does on mice?
You're dealing with a whole different metabolism, you're dealing with different enzymes, you're dealing with a different way that the animal and man may handle the same drug. Their expectations ought to be realistic, that we've had a lot of successes in mice that have not carried through in man.
Testing with human subjects and eventually cancer patients will get underway soon, but there is some positive early news. Carol Ponser, an immunologist at the University of Maryland, has been conducting tests in which human blood cells are treated with betathine and then mixed with cancer cells.
We treat those T cells with betathine, and the T cells are better able to kill the tumor cells. I considered it very exciting when we found that dramatic increase in the tumor-fighting substance.
Testing human blood cells is not the same as giving betathine to a real person with cancer. But Ponser, who has no financial stake in the development of the drug, is excited by its potential.
If you see an effect in animals, if you see an effect in isolated human cells, there may very well be an effect in humans.
It would be wonderful if betathine could do for human cancer patients what it apparently has done for Mr. C. But it will take several years of human testing at the earliest before we will know that answer. From Selinsgrove, Pennsylvania, Patrick McGrath, Fox 5 News.